Hi everybody, my name is Dominique Curley. I'm the Director of Public Health for the City of Gloucester, and I'm really happy to join you here today. I thought that it would be interesting for us to dive into meningitis specifically because we see such a rapid fall off in the high school years on this. And so here to speak with us today and shed some light on the dynamics around the meningitis vaccinations and the impact of the same is Dr. Jeffrey Stockman. Dr. Jeffrey Stockman is a pediatrician at Cape Ann Pediatrics, and I'm so happy to welcome you here and have you here today to talk to us about this important topic.
Thank you for having me. This is a great opportunity to speak for vaccines.
Thank you. I want to give you all a little bit of a background on Dr. Stockman to give you some perspective. He has an undergrad Bachelor of Science degree from the University of Michigan. He's a Doctor of Medicine, received his Doctor's of Medicine, from Tufts University. He did his residency in pediatrics at the Bay State Medical Center in Springfield, Massachusetts. He served as an assistant professor of clinical pediatrics for Northeastern, the Mass General MGH College of Nursing, the Regina and Simmons College of Nursing as well. And since 1990, he's been our pediatrician here on Cape Ann at 298 Washington Street. His interests are violin and chamber music. Like most Gloucester people, he also has a passion for fishing and boating, but he distinguishes himself by being an avid scuba diver as well. So with that, welcome Dr. Stockman, and again, thank you for being here today to answer some questions.
Yeah, so it's been 34 years, and I've had the opportunity to see patients of mine that I saw born, grow up, take care of them, and then they're now having their own children, and I'm seeing the next generation. So in that respect, I could be a grandpa pediatrician.
A grandpa pediatrician, right. In fact, on my way over here today, one of our new hires, her name's Danielle Larrabee, she is a patient of yours, and she said, make sure you tell Dr. Stockman hello. I had him for her entire life. So.
Nice.
And in fact, anywhere around the city, as I've been talking about this, everybody's like, oh, Dr. Stockman was my pediatrician. So I think you're well known among the community. So my first question is, I'd really like to understand what is the impact on the community when we see reduction in vaccination rates?
So vaccines not only protect the individual who receives them, but it also produces something called herd immunity. So if you have enough people vaccinated in the community, then our unvaccinated individuals don't have a chance to be exposed and to catch the disease. So especially young infants, I mean, we're going to talk about meningococcal disease, that vaccine isn't even given until the kids get to be in their 6th grade. So there's a big gap in the time between then and in the newborn period, and some of the mortality and morbidity from these diseases happens in the very young. So by not vaccinating, you then have this larger population of vulnerable people, and herd immunity breaks down. And these young people who don't have a chance to get vaccinated have then a chance to catch it. Okay.
Yeah.
So it's that lack of protection from the is lost.
And so we talked about the young and the pediatric community. What about other members of the community that might be impacted as well?
Yeah, the elderly are another population that tend to be even though they're vaccinated as young, your immune system can wane, may be affected by drugs that you're taking or conditions that you have. So they're also very vulnerable. And the same thing can be said for them, that the herd immunity is going to break down at some point, and then people will start to catch these diseases that are vaccine preventable.
Thank you. So on to meningococcal disease. How common is it?
So meningococcal disease, thank God, is not that common. There were 2,600 cases in the United States last year. But it is a particularly nasty disease. And it tends to affect the very young, between 1 and 4. And then there's a period in teenage to college years that there's a spike in the incidence, and then in the elderly there's a spike in that area. So it's strange. There's this kind of distribution of the timing that people catch this. It's not to say you couldn't catch it at any age, but those are the most common times.
Yeah. And how contagious is it?
Yeah, you just have to be in the same room with someone for a couple of hours and you're considered to be exposed. It's not as bad as, let's say, measles. Measles is only a couple of minutes. You can literally ride an elevator with someone with measles and then be exposed. Okay, chickenpox is another commonly known, infectious disease that we can vaccinate for. That actually takes a couple hours too before you're considered to be vaccinated.
But meningitis again, meningitis is again.
It's a couple hours, yeah.
A couple hours,
yeah.
okay.
So being in the same room with someone for a couple of hours, and then you're exposed. Yeah.
Right. And what are the symptoms of meningococcal
So we'll
disease?
distinguish between meningococcal disease. Really, it's Neisseria meningitidis is the fancy name for the germ, and it really about a third of the time can cause meningitis, which is in the word, right? But 2/3 of the time, people don't actually get meningitis; they just get sepsis. And the people who get sepsis, it can be overwhelming sepsis, which means it overwhelms your immune system and you can't fight it. Okay, and people actually do worse when they have overwhelming sepsis. So the symptoms often start off as fever. And here's something that's interesting, is that fever without cold symptoms. So you don't have a runny nose, a sneezing, a cough. You don't have diarrhea or vomiting early on. But it rapidly progresses. People look just sick. They get pale. They can develop something called petechiae and purpura, where these little red spots appear on their skin and they get these bruises, okay? And that's very characteristic of meningococcal disease. Now, if you had the meningitis, if it goes beyond your blood and into your meninges, which is the skin covering your brain, then you get stiff neck and severe headache. And that is a big red flag that you need to see someone immediately. Not just because of meningococcemia, but there are other germs that can do that too.
Yeah.
This is to say something about this disease. I mean, it's rare, but it's particularly frightening. If you're squeamish, you may not want to listen to this next part, but it often presents after the fever, as I said, the rash, okay, and then people start to really get sick. The inside of their bodies swells.
Within a day, within a few days?
Within hours.
Within hours, okay.
Yeah, within hours.
So these are rapid onset symptoms.
Very, very quick. That's, again, it's terrible. Within hours of the onset of it, you get swelling internally, inflammation. Your blood vessels start to leak. You lose the ability for your blood to clot. It's called DIC, disseminated intravascular coagulation. And, all the fluid shunts out of the blood vessels into your body, and your blood pressure drops, okay? That's called being in shock when that happens, okay? So septic shock.
Yep.
At that stage, people require, intensive care unit type of treatment, like intubation and heart-lung bypass, supportive measures with, pressors, medicines to maintain your blood pressure. But despite that, people often start bleeding, both in their internally as even externally. And as your blood pressure drops, your body tries to protect itself, especially the vital organs like the brain, heart, and the gut, by shunting blood. And it shunts it from your extremities, your hands, your feet, your fingers, your toes. And it's for that reason.
From your hands into the core of your body.
Core. So people, their hands actually turn blue, and their pulses become thready, and your capillary refill is, it takes a long time for the blood to get into your hands and feet. And it, in the extreme cases of meningococcemia, people wind up losing fingers and hands and feet as a result of the disease. That is, if they're lucky to survive.
Yeah.
The mortality rate with this disease is overall is about 10 to 15%. Certain strains of it, the W strain is one of the worst. The mortality rate on that one is 21%. So about a fifth.
The strain of it. So there's different versions of the, and is it a bacteria or a virus?
That's a good point. It's a bacteria.
Okay.
So unlike COVID or chickenpox or measles, this is a bacterial illness. And the good news there is that bacteria tend to respond to antibiotics. But the bad news is this one causes septic shock very quickly. So it's hard to treat.
Yeah. Wow. And how does it, you said 2/3 sepsis, 1/3 meningitis, as we might classically think of it. Where do you catch it? How do you catch it?
So
we talked about herd immunity, of course.
Yeah. So where do you catch it in the community? You mean?
Yeah.
So sometimes it can be. Most of the time, we don't find an index case, so you don't know where you caught it.
Yeah.
There's been rare cases where people have had cultures done in their nose, and that organism just shows up, and they're not sick at all. So those people are potentially spreading it throughout the community. Okay, they don't even know they're doing so.
Right.
Okay. The other way to catch it, of course, is to be a hospital worker and get exposed through a sick person, or maybe, as we'll talk about later, a roommate your roommate catches it and you're helping to take care of them. Most of the time, these cases just seem to come up and we don't know where they come from. Yeah. They're more common in certain countries, in certain times of year, and Caribbean and Africa, for instance, it's more common there.
Yeah.
So people who travel to those places, it's a great idea to get immunized before you go. Yeah.
And so if it's resident in your nose, but it's not in your body, is that how it works? It can just be living in there, and until you have a cut?
Yeah, they call it being colonized. So you're not infected, but you're colonized.
And so you may be asymptomatic. You don't really have it, but you're just
Exactly.
it's using you to grow on, and then it'll.
Yeah.
Okay.
If you cough or sneeze or kiss somebody, they could possibly spread it. Yeah.
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 So let's talk a little bit about the cases that you've seen, and that was a lot of the impetus for this dialogue today. What have you seen come out in your practice as it relates to infections?
Okay. As I said, I've been practicing here in Gloucester for 34 years. It's the only place I've practiced, by the way. I came right from residency to here and fell in love with this area and been taking care of kids here for that whole time.
Lucky man.
I've had unfortunately 4 contacts with this horrible disease. The first one happened when I was a young doctor, and he was 3 years old. He presented with fever, but he had only had fever for a very short amount of time, just a matter of an hour or two, like that morning in my office. It wasn't even that high. It was like 102, 103.
Yeah.
He didn't respond well to Tylenol. Even though the Tylenol and Motrin were given, his fever persisted. At that time, he didn't have the rash that we talked about, the petechiae, or certainly the purpura, the bruising-like rash. He didn't have a stiff neck, but he didn't have cold symptoms. He didn't have a runny nose, cough, sneezing, anything like that. As the day progressed, he just got sicker and sicker. He started to get pale, and he was lethargic, and labs were done, and he was in the emergency room. He was transferred to Boston. He was in the ICU there overnight. And despite the pressors and intubation and all of these things, he was gone by the next day. It was almost just a little over 24 hours that this organism took him. So it was one of the worst experiences I've seen. It was awful.
So nothing the parent could have done. It was in the air. The baby
I don't
got
want
it.
people to panic either. This is, again, very rare.
Very rare,
not all germs can make you this sick, but this is one that can, and that's why we like to see babies and young children within 24 hours of the onset, 24 to 48 hours with the onset of fever. You can always, if you're worried that things are not looking well, give your pediatrician or a doctor a call, and you can discuss, and if need be seen, like in the emergency room and stuff.
Okay.
Yeah.
Let's move on to another one.
So the second case was a 7-year-old who presented in a similar manner with fever, but she did have a few petechiae on her skin. Not a lot.
And again, those are like little pimples?
They're like, you can't feel them,
You
Dominic.
can't feel them,
you
but
can't feel them at all.
spotted.
They're flat. In fact, if you run your fingers over them, you can't feel it.
Okay.
They're tiny little red dots. And the one characteristic they have that's different than other rashes is they don't blanch. So if you press on them, they don't go away, okay? Even for a moment, okay?
Is that because that's a bleed? Like you're bleeding from your
the
capillaries?
are bleeding.
Okay.
You're starting to leak, like we talked about earlier. So she had a few petechiae, and that was a big red flag. So labs were done, blood cultures were drawn, LP was done, and she was started on IV antibiotics. Of course, we didn't know she had meningococcal at that time, right? She was admitted to the hospital, and the next day, lo and behold, the blood culture was positive for Neisseria meningitis. And she never went into shock. She recovered within 48 hours. We kept drawing blood cultures, kept her on antibiotics, you know, and she's survived with no sequelae at all, no complications or side effects afterwards. She certainly didn't lose any fingers or toes or anything horrible like that. So
how long did it take her to feel all the way better after the antibiotics kicked in?
From what I can call, by the time she left the hospital, we had to kind of convince her to stay quiet. She wanted to run around. So
feeling a lot better very quickly.
Yeah, kids are like that. It's one of the best things about being a pediatrician is most kids they bounce back so quickly. Yeah. Yes. So why her case was different than others? It could have been the strain, like I mentioned. The W was like one of the worst ones. Could have been something about her immune system, that she just had a very vigorous immune system and she responded well. The timeliness of the antibiotic administration certainly can help, but as demonstrated by the first case, it didn't really matter.
Right.
Yeah.
It had already gone too quickly.
By the grace of God, she's with us and doing well.
So glad to hear that. Much better than the first story. So now, do you have another example that you'd like to share?
Yeah,
I think
the
it's so
third one
important to hear how people manifest.
It's actually adult, colleague of mine. He's was a neonatologist, was past tense, right? Was a neonatologist at Beverly Hospital. A great man. Took care of newborn infants there for many years. He and his wife were on vacation in the Caribbean, and he, being a doctor, noticed that when he had the fever and some aches and pains, and he saw the rash. And he immediately had himself flown to Miami, where he was admitted to the intensive care unit. And much like my 3-year-old patient, he did not survive. It was very rapid in progression.
So within a day?
Yeah,
within 2 days?
With him, I think it was more like 2 to 3 days, but it was very quick. So that is a good example, I think, of a reason why to vaccinate as an adult too, okay? Especially if you travel, okay? Because you can catch, these diseases are more common in places where there are no immunizations. And it's also more common in places where people are undernourished and don't have good access to health care because their immune systems just aren't vigorous. And so you tend to see more of these diseases in those situations.
And so that's a traveler's clinic, you were mentioning that earlier? Can you speak a little bit about a traveler's clinic? What
happens if you're planning on traveling outside the country, talk with your doctor. There's actually a great website too. The CDC has a website for world travelers, and you can click into that, and it has a world map, and you click on the spot that you're going to, and it gives you a list of things that you should do before you go, including immunizations. So,
interesting.
And the other way to go about it is to talk directly to your doctor or go to the traveler's clinic where they have all these immunizations which aren't commonly given in the United States, like yellow fever and typhoid and things like that. You can be vaccinated for those things too.
Yeah. Thank you for that. And any other cases that you'd like to bring forward?
Yeah, so the last one actually was the most recent. Just happened this past, was late winter, early spring. And it was a college student at Emmanuel College.
So 19, 20-year-old?
Yeah, 19 years old. And she was living in a dorm. And her roommate developed a fever. And, being a nice person, she actually cared for her. She brought her dinner and food. She got her Tylenol. She was kind of being a nurse for her, waiting for the fever to pass. But it rapidly became obvious that this wasn't just the flu, that she was getting sicker and sicker. And she went to the emergency room and was admitted. I think it was, I'm not sure which hospital, but she was in the ICU. And she was on something called ECMO, which is heart-lung bypass. It wasn't enough to intubate her. They bypassed her heart. They bypassed her heart, and almost like if you were having open heart surgery. Unfortunately, I don't know what the outcome of that was, but with that kind of intervention, there's about a 25% chance that she would have morbidity if she survived at all.
Yeah.
Okay, and by morbidity, I mean things like the most common one is hearing loss, so you become deaf. Then after that, there's damage to your brain and memory and ability to concentrate to the point where you can even become in a vegetative type state, you know.
Right.
And then there's the horrible amputations that are quite common with meningococcal disease in survivors.
Because the blood has come into your core.
Because of the shock, yeah, and it pulls
Yeah.
everything into the core to try to preserve the heart and the brain. So I don't know exactly what happened to her, but I can tell you what happened to my patient. She was fully immunized.
There we go.
Yeah, so she received vaccines when she was in 6th grade, and then a second menactor when she within 6 months of that, and then when she was 16, she got her first meningococcal type B. It's another strain, and before she went to college, which was just before she went, she got the second one. So she had 4 meningococcal vaccines by
And
the
had
time
no
she got
symptoms,
college.
did not get sick.
She never even got a fever. All right. She did come to me quite scared, you know,
Yeah.
her mother, and quite worried. And in a case like this where there's a really potent exposure, far more than 2 hours, she'd spent some time with her and was helping her, you know.
Right.
But there's a drug, an antibiotic called rifampin that can be given. And you take that for after an exposure, and that's called prophylaxis. You're not actually sick from the disease, but it's preventing.
Yeah.
You know,
Even if it's
so we gave her
there.
rifampin prophylaxis. She was fully immunized. She never had a fever.
Right. And certainly in the Gloucester Health Department, whenever a communicable disease like this would be reported, we're alerted by the state right away, and our public health nurse would work with Dr. Stockman's office, do a full investigation, as much tracing as possible, and report back not only to the Department of Public Health, but also to our local practitioners to see what we can do to be sure that we can stem it as quickly as possible. If you are exposed, is it too late to get the meningococcal vaccination at that point? Does it have to build up into your system?
So if you have a known exposure, I think the primary thing there would be to do the rifampin prophylaxis, because that's going to give you the immediate response. It takes a while after you get immunized to build up antibodies.
Yeah.
So at that point that you're already exposed, immunization can be given, but the recommendation is to wait a little bit and just do the rifampin and then do the immunization, you know, down the line when you're sure that you're not going to come down with it.
Right.
Yeah.
Okay, and then you know, something else to call out is you know, you talked about your patient vaccinated when they were in 6th grade and then again in high school. I know also colleges, you know, schools won't let you in if you're not vaccinated from meningitis, right? And so that's another, you know, consideration that families should take into account.
A lot of colleges will not, they won't accept you into their dorm system unless you've been vaccinated. So any situation where you're living in a close community, like a dorm, a barracks, like the military, they require it.
Yep.
Okay. A barracks, mental health institutions. Often, you know, they really want their patients to be in a long term.
Yep.
Mental health institutions, prisons. I understand it's something they vaccinate.
You will get it at that
to try to avoid these, because if there's an outbreak, you know, it spreads very rapidly.
Yeah, thank you for that. And so, how can we protect ourselves and our children? You know, so from this insidious disease. And obviously, I think there's an obvious one right from the start. But I'd love to hear your perspective at writ large.
Yeah, immunization is the main thing that we can do to help maintain herd immunity in our community, and you know, and then all the normal things that you do during cold flu seasons, not sharing cups and utensils with people who are sick, not going to work or to school or sending your children to school when they have fever. I know how hard it is, especially when two parents are both working. They can't afford to take another day off from work. They don't want to miss the daycare. But you know, it is.
You hear about the outcomes of
it's potentially terrible. I mean, if you wouldn't you feel horrible if you sent your child to the daycare and they had meningococcemia or measles, and then the whole, you know, school now has measles, and your child was the index case. That'd be hard to live with.
Yeah, it'd be tough for sure.
But so those are a couple things: to not go to work, not go to school, don't send your kids to daycare when they're sick, and seek care when they're ill in a timely manner within 48 hours for children and within 24 hours with a baby.
Yeah. And so they can call, first of all, and say, I have a high fever, right?
Yeah.
And you guys will say, come in, and you'll make that happen
So
for
we
them.
often talk to people on the phone and, at night, and when parents call and they're worried, and that's what we're here for, It's a big part of what I do. Sometimes I have to recommend they go into the emergency room, but most of the time it sounds like it's a cold or a flu or something like that, and we can reassure them and give Tylenol and see them in the morning just to make sure there's no petechiae or purpura or anything like that,
And then to be able to become vaccinated, where do people go to get vaccinated? So how does your practice support that? And can you make some other recommendations around the community?
So pediatricians in general, we are really advocates for immunizations, okay? And in all pediatric practices in this area offer immunizations, including meningococcal vaccine. The one thing I do want to say about access to that is that if you have public insurance like Mass Health or WellSense, you have to be vaccinated before the age of 19, otherwise they won't pay for it.
Meaning that then you can be vaccinated, but then you have to pay for it.
Then you have to pay for it.
Before that point, it's free.
I understand it's like over $200 for each shot.
Yeah. So important to get all this done before you hit 18.
Get it done before you're 19, right?
Yeah.
So pediatricians' offices are your first stop if you're a pediatric age, okay? If you're not a pediatric age, talk to your doctor. Sometimes they can order it and give it through their office. Sometimes they can refer you to, since COVID, the pharmacies have now been places that people get vaccinated, and that's perfectly fine. And anytime we can do that, anything that will increase the access to the vaccine is a good thing. So, and they do a great job with that. Other places, we talked about if you're planning on traveling, we talked about the Travelers Clinic. That's another place that you can get vaccine. Sometimes our vaccine's not meningococcal disease, but like rabies, I'm thinking of, is given through the hospital.
Right.
So if
emergency moments,
emergency moments, they give it in the emergency room, and then there's actually a rabies clinic that's upstairs at Addison Gilbert. I'm not sure where it is in Beverly, and you go back to get your boosters there because it's not something we carry in our office. Let's hope that doesn't happen. So thank you so much for that, Dr. Stockman. Can you help me? Any closing remarks that you want to make to the community at large? And they're right out there. Yeah. So, meningococcal disease is a great example of a terrible disease that is completely preventable. And when people choose not to vaccinate themselves or their children, they're putting not only their children and themselves at risk, but they're also putting the community at risk. Many times it's young babies who are too young to have received their immunizations. Other times it's elderly grandparents who are on immunosuppressants or of cancer treatment, so their immune systems are held back. These people are particularly vulnerable to these kinds of vaccines, preventable diseases. So you're not just doing it for yourself or for your kids. You're being altruistic. That means you're doing something for others. And I think we forget that sometimes. I think people, especially in this political climate, they get angry and upset when they're told they have to do something. And I understand that. Nobody wants to be told to do something and insist and have laws. But it's not only you're doing it for yourself. And if you want to take that risk, I guess that's up to you. But remember, you're actually putting other people at risk too. And we're talking about innocent, young infants. It seems selfish when you don't immunize under those circumstances.
Thank you.
Okay.
Well said. I think this conversation with Dr. Stockman made clear the risk of not vaccinating is pretty significant to both you and to others. So I hope that this has been good information for you and you can approach this decision in an informed way.